Today we are going to talk about shoulders. The shoulder is a difficult area to understand because there are 9 muscles that cross the shoulder joint and insert into the humerus. 3 of them are prime movers: the pectoralis major, which flexes, the delts, abduction, and the latissimus dorsi, which extend the shoulder. Then you have 4 muscles that are part of the rotator cuff, and it's the supraspinatus, which is on top of the spine of the scapula and insert into this joint. The infraspinatus, which is below the spine of the scapula on the broad part of that bone. And then the teres minor, which goes from the back of the scapula to the back of the humerus. Then the front of the scapula that goes to the joint, you have the subscapularis. The remaining 2 are the coracobrachialis, and that goes from the joint down the bicep into the humerus. And then you have the teres major, which goes from the front of your humerus to the back of your scapula. And it helps extend that shoulder, assisting the latissimus dorsi. So the massage therapist has to be a detective and figure out where exactly the pain is coming from on the client in order to massage the right muscles. So there's a test where you take your arm and push down with your thumbs facing down against resistance. And if you feel pain in front of the shoulder joint, it could be your teres major. So that would be usually a rotator cuff problem. There's a table test that I'm going to show you where you can pinpoint where exactly the pain is during that test as well to figure out which muscles you should be massaging. Turning the client's hand externally and internally and asking him exactly where the pain is coming from. I like to warm up the shoulder with this type of movement before I get into any pressure points or deep tissue massage. Doing compressions on the posterior deltoid to warm up the area if I'm going to be doing any work back there. Rolling out the posterior deltoid and the lats. I'm getting into the teres minor very deeply. I'm going to add some passive shoulder movements while holding the teres minor. Speeding up the tempo and doing a little bit superficial fast work. Supporting the shoulder girdle, I get inside the scapula towards his subscapularis. Pressure points on his traps. Looking for that spine of the scapula to get his supraspinatus. Holding points allow the muscle to release itself. I'm having him actively move his arms up and down while I hold points on his supraspinatus. I'm doing the same thing around his traps. I like to do circular compressions and repeat areas with different techniques. I'm gently warming up the anterior deltoid with back of the hand tuena. This area is very sensitive sometimes, so I don't need to apply a lot of pressure. Now I'm compressing the anterior delts. And getting some insertions with the pec minor and major. Compressing the biceps and going to do some pressure points on the coracobrachialis. Now I'm inserting upward into the insertion of the pec minor and passively moving his shoulder girdle upwards for a nice stretch. This is good if you've identified the problem as a tight pec minor. I like to compress the muscle away from the insertion as a stretch. And use fingertips to pull the muscle away from the insertion for another stretch. Gently pulling the humerus out of the socket to separate some of that scar tissue if there's any there. I'm externally and internally rotating his arm as I'm doing so. I'm making sure I turn it before I actually pull. The pressure points while he's face up, and I'm going to have him do the active snow angels again as I'm doing the pressure points. Nice stretch to the neck and the top of the shoulder. Pressure points while doing the stretch. Passive movement is important so that the muscles are not engaged while going through a full range of motion. Sometimes the problem is coming from the medial deltoid, so I'm just doing some forearm rolling to get rid of the pain.